Intradermal injections are an important part of nursing practice and a skill that every nurse must learn. This program will identify supplies needed for giving intradermal injections, illustrate landmarks for sites used, and show techniques for giving these injections.
Intradermal injections are given into the dermal layer of the skin just beneath the epidermis. This route is used to administer small volumes that require slow absorption. This route is typically used for allergy testing and tuberculosis screening.
This route can also be used to administer a local anesthetic prior to a procedure, such as the insertion of an intravenous catheter.
Decontaminate hands and after the procedure using acceptable aseptic practice as indicated by agency policy. Gloves also should be used. Follow the 6 rights of medication administration: right patient, right medication, right dose, right route, right time, and right documentation. Supplies necessary for an intradermal injection include needle and syringe, alcohol pad, cotton ball, gloves, and appropriate medication or agent. Some agencies may not recommend cleaning the site with alcohol prior to giving an intradermal injection. Test results could be affected by improper alcohol use. Be sure to check agency policy and procedure. Needle gauges for intradermal injections range from 25 to 27 gauge. Most commonly used are 26 and 27 gauge. Needle length ranges from 3/8 to 1/2 inch. A 1 milliliter tuberculin syringe is used for administering intradermal injections. One side of the syringe is calibrated in the metric system. It measures in hundredths of a milliliter or cc. The other side may be calibrated in the apothecary system. It measures in minims. The metric system is the most commonly used. Injection angle is an important consideration when giving an intradermal injection. Injection angle ranges from 5 to 15 degrees. To facilitate needle insertion and to ensure injection into the dermis, the skin is stretched at the injection site until it is taut. 2 common injection techniques used when giving intradermal injections include the side approach and the front approach. When approaching from the side, the first 3 fingers and the thumb are used to hold the syringe. When approaching from the front, the syringe is held with fingers on top. When selecting an intradermal site, the nurse needs to avoid areas with bruises, inflammation, edema, lesions, skin discoloration, and veins. The most common sites used for intradermal injections include the inner forearm and the upper back. If necessary, subcutaneous injection sites can also be used. Landmarks for the forearm are 3 to 4 finger widths below the antecubital space and 1 hand width above the wrist. Identify the antecubital space and the wrist. Choose the site. Landmarks for the back are the upper portion of the back in the scapular area. Identify the scapular area. Choose the site. Locate the landmarks 3 to 4 finger widths below the antecubital space, 1 hand width above the wrist. Choose the site. Clean the site with alcohol using a circular motion moving outward. Allow the alcohol to dry. Stretch the skin taut. With the bevel of the needle up, slowly insert the needle at a 5 to 15 degree angle. Advance the needle between the layers of the skin just enough to cover the bevel. The tip of the needle should be visible through the skin. Stabilize the syringe. Do not aspirate. It is not necessary because the dermis is relatively avascular. Inject slowly. Resistance may be felt because the dermal layer is tight and does not expand easily. Watch for a wheal to appear on the surface of the skin. This indicates that the correct injection technique was used. Withdraw the needle quickly and smoothly at the same angle that it was inserted. Blot gently with a cotton ball if necessary. Do not massage the site. Massaging can disperse the agent into underlying tissue layers or out through the injection site. Immediately dispose of the safety needle and syringe in a sharps container. If a wheal does not appear and the site bleeds after the needle is withdrawn, the pharmaceutical agent may have been injected into subcutaneous tissue. The test should be repeated at a different site. Locate the scapular area. Choose the injection site.
Okay, spot here.
Clean the site. When the site is dry, stretch the skin taut.
All right, Todd.
Insert the needle. Stabilize the syringe. Inject the medication. Withdraw the needle. Blot gently with a cotton ball if necessary.
Okay, Todd, that's it.
Right here.
And dispose of the safety needle and syringe. On the correct patient record, document each intradermal injection. Indicate time, medication, dose, route, site, and any adverse reactions or complications. The medication administration record, or MAR, is initialed or signed by the nurse administering the medication.
The type of medication and type of skin testing being done will determine when results are read. Refer to manufacturer's directions. Follow your agency's policies and procedures when administering and documenting intradermal injections.